Okay, I'm going to describe acute inflammation using inflammation of the skin as an example. So here we have skin on the surface over here. We have a blood vessel right here at the bottom, and the blood vessel is lined by endothelial cells. We also have some native inflammatory cells residing here. We have one macrophage and one mast cell who will be the actors for our story. So what I'm going to do now is to introduce a foreign object into the skin over here, and it comes with bacteria, antigens, and other foreign antigens. So they're all introduced into the dermis over here. So the resident cell populations, the mast cells and the macrophages, they sense these foreign antigens, and the mast cells secrete histamine and prostaglandins, and the macrophages produces and secretes prostaglandins in response to this. These mediators of inflammation causes the blood vessels to dilate, and we call this vasodilation. Vasodilation causes increased blood flow to this area, leading to the clinical features of inflammation, redness, and warmth. You might have also noticed that in the process of vasodilation, the cells lining the blood vessels, which are the endothelial cells, have become a little bit separate from each other. These gaps allow the passage of plasma, proteins, and cells to leak out, and this fluid in the extracellular space is what causes the third clinical feature of acute inflammation, which is swelling. This fluid has high protein, high oncotic pressure, and more cells, and this is known as an exudate that needs to be differentiated from a transudate, which is usually caused by raised hydrostatic pressure. One of the proteins that comes out is the kinins, which is activated to become the bradykinins, and together with the prostaglandins, irritate the nerve endings in the area, which sends impulses to the brain, resulting in the perception of pain, another feature of inflammation, and this makes the patient refrain from touching or moving this area. The pain and the swelling contribute to loss of function, which is fifth and final feature of acute inflammation. Okay, so now back to vasodilation. So if you recall, I said that vasodilation changes the hemodynamics of the vessel, leading to more blood flow in the area. But the blood also becomes slower in the blood vessel. This results in the inflammatory cells, in particular the neutrophils, taking a more marginal route in the blood vessel, which means it tends to like to travel along the sides of the blood vessel. This process is known as margination, and as this happens, the molecules on the endothelial cells, called selectins, stick to the neutrophils, slowing them down, and the neutrophils start to roll along the endothelial cells. Eventually, even more sticky molecules, called the integrins on the neutrophils, force the neutrophil to a complete stop and adherence to the endothelium. The next step is mediated by chemokines that are released by the inflammatory cells, and this causes transmigration of the neutrophils through the endothelial gaps. Now, finally, the neutrophil is attracted by the bacterial products, complements in the area, and leukotrienes to the actual site of action. This is where it can finally do its job, either by eating up the inciting agent, which we call phagocytosis, or extruding its toxic cellular contents to outside the cell. Last but not least, the macrophages also secrete cytokines such as tumor necrosis factor alpha and interleukin-1. These cytokines augment the entire inflammatory process, like increasing the expression of selectins or integrins, or boosting the killing capability of neutrophils. But most importantly, these cytokines travel to other parts of the body to exert their effects. One important example is that these cytokines travel to the brain to affect the hypothalamus, resulting in fever. What can happen after this? Well, the acute inflammation can go on, resulting in an abscess formation, or chronic inflammation can take over. In the best case scenario, where the inciting agent is removed, everything can go back to normal again, a term we call resolution. However, this doesn't always happen. Sometimes there is excessive laying of fibrous tissue in the area leading to a scar, which I'm sure you are quite familiar with. We call this process repair or fibrosis. Okay, so this is the process of acute inflammation.